So let's talk about having a baby. Well, let's not talk about having the baby. Let's talk about what happens to your body when you're pregnant and what to expect afterwards once baby is out. It's a very passionate subject area of mine. It's an area that I've worked with a lot of the physios and the women's health physios in particular and the midwives around in the Hertfordshire area to try to help seek out some better healthcare, better education for mums, expectant mums and new mums to be. So most mums have no idea what happens to their body physically when they're having a baby, when they've had the baby, and what to expect, what's normal, what's not normal, what might they need to get checked out. So many of the education around preparing for a baby is about preparing the room, preparing for what's going to happen in delivery, preparing for what you might need when baby's here. A lot of the postnatal care is centred very much about baby, which obviously it's meant to be, but the mum has had this huge thing go on in her body, and let's face it, having a baby, carrying a baby, delivering a baby is nothing short of a huge demanding task on your body. And let's put it into perspective here. If you were to undertake a marathon, do you think that you would run 26 miles on one day without ever putting in the training for it? I don't think so. It's like having a baby. You're going to have that baby cooking inside you for 9 months. It's only going to get bigger. It's only going to stretch your body. It's only going to add strain onto your muscles and pull you out of shape. Why people still think that being able to have a baby is just turn up and the baby's just going to come out is a mystery. If you want to have a good pregnancy that not only is good for your body, that helps protect baby, if you want to have a better birth, and let's face it, the births will be how they'll be, but certainly there's things that you can absolutely do that will help that assistance in delivery. And if you want to be thinking now of how am I going to recover well, not lose weight, shape up, but just naturally healthily recover from having a baby, you need to start thinking about it in pregnancy. So start thinking about your Pilates during pregnancy and how you're going to strengthen your body. However, if you are now postnatal and you're thinking, right, what do I do? Let me just tell you a little bit what happens to your body. So during pregnancy, you have a linear elbow that runs down the connective tissue down the center of the stomach. And your abdominal muscles, either side of it, will naturally separate and split apart to allow for the growing uterus. That's completely normal. Expect that. That's totally fine. However, we don't always see those muscles reconnect back again, and they should have enough elasticity to them and strength that allow them to stretch and expand, just like your just like your waistband at Christmas time over too many mince pies. You should also expect to see them shrink back again and reconnect back to the center. That doesn't always happen, and that might be for many factors or reasons. It might be that you are very flexible but not necessarily strong. It might be that you've had no preparation in those muscles. It might be that you've had a difficult delivery. It might be all sorts of reasons why. But one of the major factors that can help prevent that is to be thinking about mobilizing the body, moving it around, stretching and strengthening the muscles that you are going to need to retighten again afterwards. So after you've had baby, those muscles should start to reattach themselves back to the center. It might take a little while, but they should reattach themselves. If they don't, what happens? Many women start to experience back pain, pubic bone pain, hip bone pain. Many women experience pelvic floor dysfunction where they might have a small amount of leakage or a large amount of leakage, either from bladder or bowel. They might find their sex life is not so good, not because of tiredness, but because of efficiency of muscles and feeling. A number of these things are all factors that can be as a result of your body not being internally strong enough yet. And what happens? Women are just desperate after they've had the baby to lose the weight. I know this myself. I've had 2 children, and all you want to do is look like some resemblance of the person that you looked like before. So it's very quick for women to go out and do, you know, classes where you're running around, you're with a buggy, you're outside, you're squatting, you're lunging, you're crunching your stomach back together again, you're jumping all over the place to try lose the weight and make your belly look like some kind of flattened state that it looked like before. But if your insides are not internally strong yet, it doesn't matter what's going on the outside. You can run around all you like, but those muscles on the inside that are not connected, from underneath at the pelvic floor, from the front, the abdominal wall, all connect to our back and connect underneath and connect from the top. So all of that is going to have an issue. Your abdominal area is connected from underneath your pelvic floor, from your front, your abdominal wall, from your sides, your waist muscles, from your back, your spine and all your back muscles, your pelvis, and on top, your diaphragm. Let's think about all those muscles. Let's think about your diaphragm. That's your breathing. That's a breathing tool. You're not going to be able to breathe as efficiently, and you're going to have some issues with your center, your rotation, your flexibility of your thoracic spine if this area is quite stuck. Your pelvic floor supports you from underneath. Well, that pelvic floor, ladies, you know, if you've jumped on a trampoline or maybe you've just run for a bus and you feel that little moment, that's your pelvic floor muscles. They shouldn't be doing that. It is not normal to accept that after having a baby, these things are normal part of having a baby and it's okay. And that is what happens. Women accept that their stomach perhaps still has this skin that is all kind of crumply, and that is the pot belly just won't go away. We accept that the pelvic floor muscles are weakened, and I have little oops moments. None of these things have to be normal. So ladies, postnatally, you are lifting baby. You are carrying the most awkward and heavy things like a pram and a car seat and a buggy. All these things are heavy and super awkward. How many times have you held your car seat like away from your arm's length with baby inside of it, and then your pelvis and your spine is all twisted at funny angles? They're really awkward things. You need to have a strong center for your body to support this crazy life that we have once we become a mother. So even though your brain is a bit scrambled, even though your mindset might be saying, I've had a baby and it's to be expected that I've got all these issues, don't put up with it, and make sure you are booking in early days to a postnatal Pilates class, and make sure this is not just a generic Pilates class that is for anybody. There are many things you might have wrong with you at this time. You may have a weakness. That's fine, we can get that stronger. But you may have a pelvic floor prolapse where the muscles have fallen through. You might have an abdominal separation where the muscles have not reconnected together again and have at least 3 fingers between them, and you can feel like you can put your fist inside your belly. That's an abdominal separation. We should not be stretching, crunching, twisting, lifting weights, planking, running, all of these things if we have pelvic floor issues and abdominal separations or weaknesses here in our abdominal wall. So don't start off with those classes. Yes, really think about your nutrition, and yes, really think about how you can rest and look after yourself, and yeah, be there for your baby. But mums, you must look after yourself. You are number one. Baby is going to get no use if you aren't looking after yourself. And even if you can't see it, your insides really need a little bit of love. So go to a women's health physio if you're worried about any issues you think you might have some stuff going on. Go and seek somebody who will do some manual testing. If you're fine, then you can come into a postnatal class and we can work with you as you are ready and as you develop through your postnatal and as you go through your, say, 4th trimester. So think about your 1st, 2nd, 3rd trimester of pregnancy. Give yourself another 3 months for your 4th trimester to allow for your body to start healing and repairing. Then after about that time, start to sort of ramp it up a bit and think about going back to regular classes and getting back into that full cycle again. If, however, you have got any issues, come and see us on one-to-one At the Pilates Pod and many other places, as well as our Pilates training, we are also women's health experts in exercise. So we've gone through the Caroline Anthony program, who can help you repair and recover from diastasis, abdominal separation, from pelvic floor issues and dysfunction, and with cesarean healing. This is separate to Pilates. It's work that will work with you in the studio and that you can do at home to give yourself a good start. Add that in regular practice, as well as some postnatal modified work, and you'll be cooking. We've had ladies that have had 8 centimetre gaps shrink back to nothing, but we've also had ladies that have got 8 centimetre gaps who've had it for 8 years because they thought it was a normal thing that their belly looked like now they've had 2 kids. Honestly, ladies, don't accept it. The sun is now blocking my view and probably your view, so let's call it a day there. But ladies, if you need any help, then come and speak to us at the Pilates Pod, and we'd be delighted to see you all in our prenatal Saturdays at 11 or a postnatal Mondays at 10:30 classes, and any day of the week for one-to-one help. If you need any advice on where to go for women's health physio, get in touch and we'll put you into the right contacts. See you soon.